Good evening, everyone, and welcome to the 1922nd uninterrupted webinar series of IFPH. And here we gather a global platform across the world to unite all the well-wishers, friends, teachers, and all those curious about homeopathy. And today we have our chief guest, Dr. AMRUTHA MANOHARAN, a distinguished personality who was the former lecturer at White Memorial College, and she has lectured at Nightingale Nursing College, and she is also a senior research fellow at National Homeopathic Research Institute in Mental Health, Kottayam. And today she will be presenting on the topic angio edema and homeopathy. I welcome you, ma'am. The floor is all yours.
Sir, is it visible?
Yes.
Yes, ma'am. Now it's visible.
So, our today's topic is about angio edema and homeopathy. Okay. So before we begin session, hope any one of you have experienced this condition, or at least one case have come to your clinic with this angio edema. Okay. So, do you have experienced any angio edema case before?
Better to go with because
Do
everybody.
anyone experience any angio edema case before this? Okay. So let's begin the session. So first of all, I thank our beloved master, Dr. Samuel Henman, and let's begin the session. So angioedema is a localized transient swelling of the deeper layers of the skin. Okay. Deeper layers of the skin, mainly the skin and the mucous membrane, resulting from the increased vascular permeability and fluid leakage into the interstitial tissue. So it is often associated with urticaria, that is hives, and it also may be occur independently. The condition can be acute as well as chronic, allergic or non-allergic, and sometimes it is life-threatening when it involves the respiratory tract. So it is generally considered as a swelling. Okay, as the name suggests, edema simply means swelling. So angioedema is a localized and transient swelling of the deeper layers. It involves the skin and the mucous membrane. So what is the reason is it occurs due to the increased vascular permeability. So as the vascular permeability increases, there occurs fluid leakage into the interstitial tissues. So next condition is urticaria. So urticaria is, I think some of you have experienced this condition. Then it is often associated with urticaria or hives, but it can also occur independently. So this is the typical picture of urticaria, that is the angioedema. What are the main causes? The main cause include genetic factors. That the main cause of the genetic factors include there is a C1 esterase inhibitor. Okay, the C1 esterase inhibitor is the key pathogenesis behind angioedema. When there occurs any deficiency of the C1 esterase, so we have a net issue, and sorry for that.
Yes.
So we were discussing about angioedema condition. Okay. So the reason I already mentioned that angioedema is a clinical condition which occurs due to the increased transferring of the deeper layers of the skin and mucous membrane, mainly occurs due to the increased vascular permeability. You see the pictures of angioedema. So the causes, so first is allergic, that is Ig-mediated angioedema. It may occur due to the trigger of some allergens, mainly from the food, that is the nuts or the shellfish or the eggs. Then it is associated with the Ig-mediated. Then next one is the non-allergic, that is the drug-induced. It is mainly due to AC inhibitors and NSAIDs. NSAIDs means non-steroidal anti-inflammatory drugs that are mainly used for controlling the pain and also certain antibiotics. This is mediated by bradykinin. Okay, we will deal with it later. Next is hereditary angioedema. Hereditary angioedema mainly occurs due to the dysfunction or deficiency of C1 esterase inhibitor. As I already mentioned that angioedema is mainly the main pathology of angioedema lies behind the deficiency of C1 esterase inhibitor. So in hereditary angioedema, there is a problem with the genetic component of the C1 esterase inhibitor. Then it leads to the unchecked activation of the complement system, which in turn increase the release of bradykinin. This is acute angioedema. Acute angioedema mainly due to some autoimmune diseases and mainly the lymphoproliferative diseases such as myelomas, lymphoma, etc. Next is the idiopathic angioedema. The cause may be unknown. So this is the cause that is when angioedema occurs, there occurs a localized swelling, and the main pathophysiology is C1 esterase inhibitor deficiency. So in turn, we will shortly discuss once again. So angioedema occurs due to the localized swelling of the skin and mucous membrane. The main pathology is increased vascular permeability, mainly from the fluid leakage. It may or may not be associated with the urticaria. So the main causes include C1 inhibitor deficiency, drug-induced allergic, and frequent infection. Allergic means it is mediated by IgE. Then non-allergic means drug-induced. It is mainly by AC inhibitors and non-steroidal anti-inflammatory drugs. Then hereditary angioedema, it mainly occurs due to the C1 esterase inhibitor deficiency. Next, acute angioedema, it mainly occurs due to autoimmune condition or lymphoproliferative disorders. So the main pathophysiology, the fundamental mechanism in angioedema is increased vascular permeability, which is mainly caused by the release or the accumulation of the chemical mediators such as histamine, bradykinin, and complement-derived peptides. Okay. So when there occurs a fluid leakage, when automatically the fluid leakage increases, the vascular permeability also increases, and it leads to the fluid accumulation and edema formation. The main factor is the chemical mediators like histamine, bradykinin, and complement mediator. So here you can see the pathophysiology of angioedema. It mainly occurs due to the C1HN. That is here you can see the C1 esterase inhibitor deficiency. So as I already mentioned that the pathophysiology occurs due to the C1 esterase inhibitors deficiency. It has mainly two forms. Okay, histamine is there and also bradykinin is there. So angioedema is classified into two types. That is a histamine-mediated angioedema and the bradykinin-mediated angioedema. So as the name suggests, when there occurs a histamine-mediated angioedema, we can see history of allergy. Okay. We can see history of allergy and urticaria in histamine-derived angioedema. Histamine-mediated angioedema is secondary to the mast cell and basophil activation. When our body is sensitized to allergy, the immune mechanism of the body will be activated, and there occurs release of the mast cell and basophilic activation. Whereas in bradykinin-mediated angioedema, it mainly occurs due to the hereditary angioedema occurs due to C1 inhibitor deficiency and angiotensin converting enzyme deficiency. So bradykinin-mediated angioedema is a hereditary condition, and there also occurs complement activation. So the pathophysiology I will discuss once again. Pathophysiology mainly occurs due to the increased vascular permeability, mainly occurs due to the accumulation of chemical mediators, histamine, bradykinin, and complement-derived peptides. Allergy, it is mainly classified into two types. That is a histamine-mediated and also the bradykinin-mediated. The histamine-mediated mainly occurs due to the allergic type, Ig released type. The mast cell and basophilic activation will be there. The bradykinin-mediated angioedema, it mainly occurs due to the enzyme deficiency. It is a hereditary condition, occurs due to the acquired C1 inhibitor deficiency and also the angiotensin converting inhibitor enzyme. So the main clinical features. So these are the main clinical features. When there is angioedema, there is a sudden and localized swelling along with the non-pitting edema. Sometimes there will be itching and sometimes there will be non-itching of the skin and the mucous membrane. So the commonly affected site include lids, that is the lips, upper eyelid, tongue, hands, feet, genitalia, and laryngeal and pharyngeal mucosa. So angioedema is commonly, it is not a very life-threatening illness unless and until it involves the respiratory and pharyngeal mucosa. Okay. When it occurs in the respiratory and pharyngeal mucosa, it automatically leads to difficulty in breathing and ultimately lead to the death of the patient if it is not approached the hospital on time. Okay. So these are the symptoms of angioedema. There will be liver swelling of the hand, edema, hand swelling, and also swelling of the foot. Then associated symptoms. So associated symptoms include pain or burning sensation. More than itching, there will be pain and burning sensation. There will be difficulty in breathing associated with and swallowing when it is involved in the larynx. Okay. When the abdominal symptoms include, there occurs nausea and vomiting. In hereditary forms, there occurs without urticaria. So the main complication, the first and foremost complication include airway obstruction is a life-threatening emergency due to laryngeal edema. Then anaphylaxis, mainly triggered by the allergy. Then chronic relapsing edema, which causes disfigurement. That is a continuous edema of the body, which in turn lead to the disfigurement. Then psychological distress due to the recurrent and unpredictable attacks, because the patient is not able to aware when the disease is going to happen, and sometimes suddenly when the patient is in a family function or something like that, they will suddenly experience this and they will be in a mentally in a condition that when some food items will be taken, automatically they will be developing this condition. Okay. So they will be constantly, they will be having a constant psychological distress. Then abdominal complications will also be there, which may mimic acute abdomen. So these are the complications. These include airway obstruction, mainly asphyxia, then the lip swelling, abdominal pain, then this swelling of the lips, visual disturbance, and functional impairment. So who is at most risk? What are the persons? Who are the persons who is at most risk? That is the person having hives or urticaria before. Before the patient, there is a history of urticaria or hives. Then heavy body wide allergic reaction in the past, history of any injury, sudden temperature change, stress or anxiety. Then the patient who is undergoing dental procedure and ovarian cyst. So these are the persons who have increased, that is a family history of angioedema, then AC inhibitor medication, autoimmune conditions, and frequent allergic reactions. So we will once again discuss the pathology to make it clear. Pathophysiology mainly occurs due to the increased vascular permeability by the release of histamine, bradykinin, and complement mediated pathway. There are two forms, that is a histamine mediated. Histamine mediated mainly triggered by IgE and AEC, that is allergic reaction, and bradykinin mediated, which is in turn released by the deficiency of C1 esterase inhibitor deficiency or the angiotensin converting enzyme deficiency. The main clinical features include, there will be swelling. Swelling will be sudden and localized. Then will be non-pitting edema will be there. Then the side effects include, the commonly associated regions include the lips, upper eyelid, tongue, hands, feet, genitalia. It is often complicated and life-threatening when it includes the laryngeal and pharyngeal mucosa. So associated symptoms include pain or burning, difficult breathing, abdominal pain, nausea and vomiting, and hereditary episodes occur with a recurrent urticaria. So the main complications include airway obstruction, which is a life-threatening complication caused laryngeal edema, anaphylaxis, chronic relapsing edema, psychological stress, and abdominal complications. So the person who is at risk include history of angioedema, history of hives or urticaria, history of allergy, history of injury, anxiety, dental procedure, and ovarian cyst. So how we can diagnose a person is having angioedema? So one thing is most clear that when it is a histamine-induced angioedema, we can check for IgE and AEC. Okay. So first one is the serum C4 and the C1 inhibitor enzyme level. Next is the allergy level, that is a screen prick test and the IgE level test. Then history of drug evaluation, that is if the person is has allergy to any particular drug. Coming to the homeopathic management, so first one is EPIS. EPIS, as we know that it is one of the key remedy for allergy and urticaria. It has a rapid swelling, especially on the lips, upper eyelids, throat. There will be burning and stinging pain and marked redness. It is worse from heat application and better by cold application. So there will be intense itching, burning, swelling, and redness indicated in puffiness and edema, especially of the eyes, lips, face, extremities, worse from heat, touch, and lying down, better by cold air and uncovered. So Apis mellifica has one of the typical symptom of angioedema. Next is urticaria urens. There is swelling with intense itching and burning. It is useful in allergic and urticarial angioedema. Effective in urticaria linked to selfish, bee stings, and rheumatism. Useful in angioneurotic edema with intense itching and swelling. So when there occurs a case of angioedema with urticaria, this is one of the most important remedy we can use. So I forgot to mention that EPIS is commonly used in 30 and 200 potency. But remember, in case of pleural effusion or CA lungs, don't repeat EPIS unless and until you get symptoms. Okay. There are many cases and many doctors who have spoiled the cases of CA lungs with this EPIS medicine, and also which in turn lead to the death of patient. So next is urticaria urens. Urticaria urens lead to the angioedema with a history of angioedema with urticaria. The next is lacusis. Lacusis, there occurs edema around the throat and neck with a choking sensation and cannot wear tight clothing. The left side predominance will be there that goes after sleep. Next is arsenicum album. Angioedema with anxiety, restlessness, and burning pain, which is worse at night and better by warm, is indicated in pale, puffy swelling with burning and restlessness. Usually, the are cell present with the typical symptoms of the mental restlessness, mainly the that aggravation. Next is belladonna. Belladonna, there is a sudden swelling with heat and intense redness and throbbing. So the characteristic feature of belladonna, there will be intense redness and throbbing. So there will occur a rapid cause of the disease. Then histamine hydrochloricum. So it is allergic reaction and histamine mediated swelling. It acts as a homeopathic antihistamine. Okay. So histamine, it is one of the medicine generally used for allergy, that is histamine, is usually given in the 30 potency. Okay, 30 potency if not available, or if we cannot get the correct result, we will change into 200. So it is one of the good remedy for allergy and urticaria. Next is C1 esterase inhibitor. This is hardcore preparation. So do anyone is aware about this medicine? Is there a medicine in homeopathy that is a C1 esterase inhibitor? So actually, C1 esterase inhibitor medicine is not available, right? There's a scope of research in homeopathy, that is, we have to potentize this medicine and also use this medicine for the clinical cases. So C1 esterase inhibitor, we can use it as a sarcode for the further treatment. Next is antipyrin. So antipyrin is a medicine which is available in homeopathy. That is, it acts on the vasomotor center, causing patchy dryness and puffiness, especially on the face and the lids. It is usually used in angioedema and urticaria mainly with the sudden eruptions and the internal coldness. Next is Agaricus muscaris. Agaricus is recommended in cases with itching, burning, bluish puffiness, and the skin and the face feels frozen. Sometimes there may shift the location. Okay, in this case, they may be shifting the location. And agaricus, it has a peculiar sensation, that is the pricking like sensation will be there. So next one is the Helleborus niger. Helleborus niger, there is a pale or reddish edema, especially of the face and legs. It is indicated with the angioedema with a sudden watery swelling, worse at evening and when cold exposure. It has a complaint aggravated during cold exposure. Next is Hepar calcareum. It's used in hypersensitive patient prone to angioedema with chillness and splinter-like pains. The typical feature of Hepar, that is a splinter-like pain, will be there. The symptoms are worse in cold and improved at warm and damp. So these are homeopathic medicines which are commonly used for urticaria. The condition is first one say yes. Rapid swelling along with the burning and stinging pain along with the swelling and edema of the body. Then next one is the urticaria urens, usually allergy and urticaria with history of eruptions. The next is the lachesis, which has edema on the throat and also a choking sensation. Next is arsalb, the anxiety with typical restlessness. And belladonna, the sudden onset of the complaint and rapid course of prognosis. And histamine is a allergic reaction. It is mediated by allergy. Mainly, it is used in histamine-induced angioedema. Next is C1 esterase inhibitor. This is scope of research in homeopathy. We can isolate the medicine and prepare the medicine. So, further studies have to be conducted. Next is antipyrin. Antipyrin acts as a on the vasomotor centers, causing patchy redness in puffiness, especially on the face and lip. Useful in angioedema, urticaria with sudden eruptions and internal coldness. Agaricus, mainly itching, burning with puffiness, and also there will be shifting of location of the skin symptom. Helleborus, there is redness and edema of the face and angioedema with the watery eyes. Hepar, the patient will be sensitive and also there is a splinter-like pain. So, what are the foods to avoid in patients with the urticaria? So, certain food items are to be avoided in patients with urticaria, mainly tomatoes, citrus fruit, pineapple, strawberries, and apples. Mainly nuts, the nuts items and shellfish, the dairy products like milk and cheese are to be avoided. Next, fish, garlic, onion, green salad, bread, banana, and alcohol. These are to be avoided. And high histamine foods such as the fermented foods, that is the packaged foods, and also the processed meat, alcoholic beverages, it also to be avoided because the histamine content is more in this. And spicy food has to be avoided. And the preventive measures. So the first and foremost thing is, once you get an attack of angioedema or urticaria, you have to be sure that which food is causing this condition for you and better to avoid the food. Identify the non-allergens and triggering drugs. To manage the stress and maintain a healthy immune system and direct care, mainly dietary care, avoid the food items which is causing the disease and regular follow. So apart from we are already mentioned that when a patient comes to us with the allergy or urticaria, we will check for allergy, okay, IG and AC. Then there is also a test available, that is the allergen. Mainly in allopathy, there is a test available for which all of the medicine the patient will be sensitive for allergy. There will be a panel of tests for each and every medicine. Then they will be given a chart for which medicines they are sensitive. Then they from there they will be indicating with the plus, okay, plus when they are so much sensitive. Same like that, when the patient is sensitive to certain food items, there are also allergy checker for the foods. Okay, which foodstuffs you are being about to sensitive to allergy. So initially the cost may range from 3,000. Depending upon the lab, the test and the rate may vary. So this test is very much useful in case of kids. Okay, the kids from which items they will be sensitive, so the parents can avoid such type of food items. So next is next once again I will discuss about the foods to avoid. That is the tomato, citrus fruit, pineapple, strawberries, nuts, especially the tree nuts, and the shellfish, milk and milk products, then fish, onion, cheese, salad, then histamine-induced foods like the fermented food, processed meat, alcoholic beverages, spicy food are to be avoided. And the preventive measures include identify the non-allergen and triggering drugs, and manage the stress and maintain a healthy lifestyle, and avoid the products which are causing allergens to you. Then regular constitutional homeopathic medicine. So next is a case study. So a case of angio edema of the lips of an old age woman treated with a homeopathic medicine. A 96-year-old lady complained of swelling on the upper swelling of the lips and was reported on 25/4/22 morning around 10 a.m. by phone, and the bystander was asked to take the photo and sent to me. So the patient had history of eating food from outside, and the color developed after that. The swelling of the lips developed along with the burning pain. The rubric taken was face swelling, lip and burning. So EPIS was given. EPIS 30 was selected based on the simillimum, and 3 pills was given to 3 pills was given only in globules, and the complaints disappear by the noon. So the main key indication is lips swollen, red, shiny, puffy, burning, stinging, sudden puffiness of the whole body. So here to discuss about the management of acute disease. So in aphorism 72, our beloved master Samuel Hellman has mentioned about the treatment of acute disease. That is, acute disease are the rapid morbid process of the abnormally deranged vital force, which have a tendency to finish their course more or less quickly, but always in a moderate time. So the urticaria complaint will sometimes it may last for a few hours, or sometimes it may last for days. Okay. So our ultimate aim is to get a complete cure to the patient immediately. So this is a case of individualized homeopathic medicine given in acute remedy. So this is the picture before treatment. This is the picture after treatment. So medicine is given. So next area of research in homeopathy, there is a new study that is most of the time our medicines and our system is being criticized because they are not having any scientific evidence. So where this medicine is going right. So we know the pathophysiology behind angioedema. Okay, it is mainly occurs to the C1 esterase inhibitor deficiency. So our medicine EPIS. So the EPIS has a modulation of the inflammatory pathways. So EPIS is going to act on the inflammatory pathway, and the laboratory study of EPIS extract has found the anti-inflammatory effect mainly by the release of the pro-inflammatory cytokines, and also it has a immune modulator action. So it is collected from the sources of the research articles, and from that only we get the scientific study of Apis mellifica for this urticaria condition. That Apis is has a immune modulatory effect on the pathways, mainly the C1 esterase inhibitor pathway, and also the anti-inflammatory and also the pro-inflammatory cytokines of the Apis is going to have a action on the master cell activity, that will suppress the master cell activity, which in turn result in the decrease in the angio. So control homeopathic medicine is effective in treating angioedema. So these are the bibliography of the references for angioedema, and you may check. And thank you once again. So I thank each and everyone for giving me an opportunity. Manusharan Tanesha and Jeff Shadi sir, and thank you for giving me an opportunity. I am extremely sorry that in the beginning there is a problem with the net, so I was able to convey it properly. And thank you for the patient listening.
Yes, thank you, Dr. Amrutha Manohar. It's a nice presentation. I think what is more important is homeopathy has got a lot of medicines. So that is the most important thing. The medicines that will not create further complications. because these patients are always hypersensitive patients. So while administering the medicine in such cases is very risky, especially the allopathic medicines. So in such cases, homeopathy is really a boon, and it's up to the common man to utilize this God's great gift. Dr. Sanesh, join back. Dr. Sanesh, please proceed.
Yes, Dr. Amrita, it's really an excellent session, even though your subject was a different one. That you narrated it in a good way, and we got good expertise on that, because everybody thought that it may be something else, but it was a simple problem, but it's a big problem. And usually we as homeopaths used to get such kind of patients every day. That's the reason why you asked from the very beginning itself, how many of you have seen the case. Really, uh, everybody must be a little bit late in answering, but then once you explained everything, it was really an excellent session. And we used to get all those allergic conditions, particularly skin eruptions are used to come, and we used to say that, oh, it's allergic urticaria. But it has a specific reason, and that's the reason you explained in this angioedema. What is angioedema and how it can be managed, and what are the medicines? Usually, at some times, children may come up with this kind of eruptions and the kind of angioedema, and people may come and so, doctor, it may be due to some external itching, bite or from some organisms or like that. But it may not be. Sometimes they may come and say that, oh, it is because of the touching of some leaf of some kind of plants like that. But actually, whatever be the reason, homeopathy has a solution. And that's what. For example, when it comes with a bite of an organism, this external organism, we can simply give a piece if it is in edema in general, and if it is on both side, and as well as it may go downwards also. The patient may have no thirst at all, even though there is edema. Usually there is a huge collection of water in the body. Then we will have to think of a bell donor, because when sometimes patients may come and say that, oh, it is coming, the doctor, just 1 hour only it has started, and all of a sudden it will get worsened, and you see the chips, lips, and everything is a red, bright red, and in those conditions, belladonna will works wonderfully. And sometimes it may happen with the children who are having worms manifestations, because when there are a lot of worms in the body, in the abdomen, it may produce a little bit of lava, and it may come through the lungs, and it may reach to the blood, and thereby it may produce a kind of urticaria. In those conditions, Sina can be a best choice. The symptoms you narrated, the red color, burning, itching, pain, and all those things will be there in all these conditions. But it may be a little bit, there may be little bit differences in the manifestations. This is also I would like to add to the session. And when if you are not able to find the typical reason, then you can begin with a dose of sulfur 0 or sulfur 0 like that. That may produce a good result to finish the case, or sometimes that may help you in curing the case also. That's what I have seen in some of the cases. Anyway, we can have discussion from others also. Those, yes, Saria, you can invite others. Please raise the others.
Does anybody want to ask any questions or interact? Please raise your hands so we can.
Yes, because you are using this mobile phone, it's not easy for you to watch who are raising the hand. That's the problem. The prayer is basically think. Anyway, I think I must add one point here because this is from my experience. Once I gave a patient lycopodium high potency, and I advised the patient not to take prawns or shellfish because the lycopodium has got aggravation from shellfish. Unfortunately, what happened is that somebody from Gulf came to his house and he invited for a party outside there for a dinner. He got a lot of plenty of fresh, big this prawns. He knowingly or unknowingly took a piece of the prawn. Suddenly, the patient developed angio edema. Suddenly developed. So, very acute condition. So, whenever you prescribe the medicines, you must adjust or you must give advice regarding the diet regimen according to the medicine also. So the weather condition is important, the disease condition is important, the pathology is important, as well as the medicine is important. So individualization, that is why Hanuman often mentions the aggravation of his own disease. What is his own disease? It means the character symptoms or the symptoms possessed by that person alone. That's why we always claim we treat disease, not disease, but patients, persons. So that component is very important, and in each and every patient, we must be very much aware of such conditions, especially in the hypersensitive patients. And moreover, these type of responses can be expected in almost all cases of this allergy, asthma cases also, because we all know there is a basic and a hypersensitive reaction. Then another thing is that in the recent days, we know the persons taking different kind of foods which are not at all it is not follows on another thing on food not follows other thing, often antagonistics. So such conditions also develop these allergic reactions. So definitely we must focus on that and we must study on that. I think we should have some separate courses on that. So can start some specialization on this food allergies and other things. Thank you.
Thank you, sir. Is there anyone else who would like to say something?
Dr. Hema Shekhar, do you want to speak? Yes, you can speak.
He is the medical officer and he is going to say
Yes.
speak in the next session. Dr. Hema.
I just joined.
Okay. Have you ever experienced such cases, and what is your observation, and what are your methodology of treatment in those conditions? Angio edema.
Sir, excuse me, I didn't hear the previous talk. I just joined.
Okay. Then Dr. Sahir Abbas, do you want to speak? If you want to speak, you can speak. No.
No. I think Dr. Amrutha, what is your comment on my opinion? Dr. Amrutha, please. I can't see you. Why you off the camera? Please keep the camera on, please. Is there any technical problems? Then okay. Otherwise, please open your camera.
Then there's some network problem is there.
Okay. Okay, don't worry.
It's you can speak, but even though your camera is not working, you can speak. Yes, Dr. Ambrose, sir, what's your opinion or what is your experience with this kind of angioedema?
Yes.
Thank you. Thank you. Dr. Dhanesh ji, everyone, namaskar. Very nice, excellent session. Dr. AMRUTHA MANOHARAN. Very nice. And anti-allergy. Anti-allergy, ANGIO OEDEMA. Very beautiful describe the ANGIO OEDEMA. ANGIO OEDEMA, first background of phoric diathesis and suppression of any disease, any suppression of food, suppression of allergy, allergy of food, जो है energy of food, angio oedema suffer, actually focus of leaf redness and urticaria sign in the body, and very good remedy. Rustux belladonna is a very good remedy. Herum phos is a very good remedy. Angioedema and background of story, suppression, sulfur, arnica, etc. Very good remedy. Very, very thanks, Dr. Thanks, Dr. Amrutha
Amrutha Manoharan.
Manoharan. A very nice presentation and difficult, long time treatment, long time treatment due to suppression of any disease. The excessive of drugs, allopathic medicine suffer from NGO origin. So very, very thanks. Thank you.
Okay.
Yes.
Dr. Ganesh, let me add another point. I think the dosage is also very important. The attenuation. In such case, how you would administer the medicine to such patients? That is very important. Because we know in such condition, Hahnemann always advises olfaction is the method, not injection. So another thing is that don't give medicines in water. Such cases, that will definitely, if you administer the remedy, that will cause reactions, response. So that is very important. Then the medicines like Romex is another medicine, Romex Ruspus. Then Rus venatum, more than Rustox. Rus venatum is more powerful than Rustox. Then another medicine is Sorinum, because we all know that this is the transient explosion of latent sora is the manifesto of acute diseases. So we must follow the first prescription with this anti-miasmatic medicine. Then the complaints will recover. Then creosote is another medicine. We have I think hundreds of medicines. This Natramur, Glonine, so many medicines are there. Natrangar, Antigrude. So we will serve there. Thank you.
Yes, exactly. These were some of the reasons. There are reasons also why you, for example, if you takes if you had a little bit of meat, then you may develop this kind of things, and then Parsatla will works wonderfully. And in those conditions, you can advise the patient that it is better to avoid that kind of food whenever if it is happening regularly. But frankly, if the patient is a typical pulsatile constitution, she can take the meat at any time. It may do any harm. That's another point I would like to add, because that if and in conditions in which the patient is saying that, doctor, I took some spoiled meat from some hotel, and that may be the reason. In those conditions, arsenic will be the, and thereafter I have this kind of itching and this kind of edema. You can see on my lips and face and everywhere. So in those conditions, you can directly give arsenic alba. That will work wonderfully. So the reason behind the illness is also very, very important, and that will, if you are able to find the reason behind the illness, you can easily give the correct minimum in the shortest possible time, and thereby you can speed up the recovery or the cure. And that's sometimes we may not get the patient may not open up and say that, no, I didn't take anything like that. But sometimes when after giving the medicine, still the patient may not get relief, then she or he may come day after, very next day. Then if you ask, then only she may remember, oh, doctor, last time I took that thing, and every time when I take this kind of meat, I get this kind of eruption. So that's the reason. Now we can see that people used to say that I have applied this and that on my body to avoid this kind of itching. But what happened is that if they used to apply this thing, the duration of the illness will prolong. And if you don't apply anything externally, your problem will be vanished in a very short time. That's what I would like to add to this session. If
Dr.
anybody,
Anesh, yes, of course, we must always aware there is a medical emergency condition. We will not get much time. So should be more sensitized to these conditions. Recently, because a lot of persons are in the habit of taking mushrooms, very, very dangerous one. And absinthe is a medicine for mushroom poisoning. So we must always be prepared to face such contingencies.
yeah, exactly. That's the reason why you need to observe. You need to ask such questions. Whether you took anything, whether did you have. Sometimes the patient may say, "Oh, last time I had a bath in the pond, and after that everything developed." In those conditions, we can give camera as well as or calcareous carb. That will work wonderfully in those conditions. When washing your body in mud waters or some that may produce this kind of thing also. So there are many reasons, and the reasons, finding the reason in the right way will be more effective than simply giving a medicine and just looking at the face or the body of the patient. Just and sometimes people used to say you can apply this or that on your body there so that it won't do the harm. But actually, it is better not to apply anything externally. Let the patient to take maximum water. Let the patient to take simple diet till the body is healthy and back it to normal. Sometimes all these patients are coming with itching as well as vomiting also. Then we can think of some toxic poisoning inside, and that may be the reason why the body is trying to protect himself or herself by that. But yes, it's over to Dr. Amrutha to say something, and then Ms. Idea will conclude the session.
Sure, sir.
Yes, Dr. Amrutha.
Dr. Amrutha.
Hello, sir. This was a case simply mainly for urticaria and angioedema. Sir, as far as our system is concerned, we have to do furthermore research in field of angioedema because, as I already mentioned, that the new concept in this, we already even know the condition about the angioedema and urticaria they have experienced, but when there occurs in the when where our medicine is going to act, that is the reason. So EPIS, here in this case only, I have get cured by this EPIS medicine. So only I have checked the review for EPIS, and only it has found the action on the C1 esterase inhibitor. So for each and every medicine, same like that EPIS, we have so a lot of medicine for angioedema and urticaria. So for each and every medicine, we have to find the scientific study for this angioedema, and that's all. And thank you, sir.
Yes, Dr.
Thank you, ma'am. Shall I conclude, sir?
Yes, please.
Thank you, everyone, for attending this session. That was all for today. And before leaving, I'd like to remind everyone that in case anyone has missed a session or you want to rewatch it, all our videos are uploaded daily in the IFPH YouTube channel. Thank you, everyone, and have a good evening. Thank you, sir.
Yes, over to Dr. Manoj.